All right, so we're here with Dr. O. This is our first blog. What we're gonna do with these blogs is we're gonna take really basic questions that people have, and I'm gonna try to answer it in a very scientific and evidence-based approach. One of the most common questions I get from younger patients and friends interested in skincare is, when should I start getting Botox? There's no evidence-based answer for this question, but there's an answer that makes sense to me from a scientific and common sense standpoint. Wrinkles on the skin develop due to a variety of known causes. These causes include increased age, ultraviolet light exposure, smoking, and the thing that's relevant to our discussion is repeated facial expression. There is no scientific evidence proving that Botox decreases actual aging, but it is a well-established fact that Botox does inhibit or limit facial muscles that are treated, and as a result decreases these repeated facial expressions. I think the answer to our original question now becomes clear. We make facial expressions all the time. Therefore, getting Botox starting now will help prevent wrinkles from developing in the future. That being said, there are numerous things to keep in mind before getting Botox, and it's very important to be consulted by a board-certified dermatologist prior to considering starting Botox. There are several short-term side effects that I won't discuss here. Many of these short-term side effects can be avoided or minimized when having these treatments performed by a board-certified dermatologist. In regards to long-term side effects, there have not been any well-established adverse long-term effects with repeated Botox administration. One potential long-term risk is that your immune system makes antibodies against the botulinum toxin, which results in the Botox not working anymore because the antibodies neutralize the toxin once injected. So this is not common, it is not dangerous, but if it does occur, there are different types of Botox that can be used to provide the desired cosmetic effect you're still looking for. Long-term Botox use has also been shown to cause muscle atrophy. This makes sense from even a non-scientific standpoint, as the less you use a certain muscle, the smaller that muscle will become. This may even be beneficial in the long term because weaker muscles will contract less strongly and as a result cause less wrinkles. Other than that, there hasn't been much literature on long-term side effects. We can't say no long-term effects exist, but what we can conclude is that through the many years Botox has been used on humans, no clear, established long-term adverse effects have been identified. There was one interesting study published originally in 2006 and then followed up again in 2014 on two identical twins that were followed for 13 years. One of the twins received Botox 2 to 3 times per year, while the other did not. The study concluded that the twin who received Botox regularly had less visible wrinkles at rest compared to the twin that didn't. Similar results were noted at the 6-year follow-up study. No long-term adverse events were reported in that study at all. This is just a brief discussion, but I hope it helped clear some questions for people interested in Botox. Thank you for tuning in.